Hello, I'm Dr. Ellie Harrison. Meet ein Paranisten.
Raw cabbage is good for dieting and good for the body, people say. But then you wonder, why have I been feeling tired lately? And why are my hands and feet swelling? For older adults, this is not something to brush off. Cabbage could be part of the problem. Have you ever woken up and felt your legs slightly heavy, then slipped on your slippers and noticed, for no clear reason, they suddenly feel tighter than usual? Have you ever eaten what you consider a healthy diet, yet your stomach becomes bloated more easily, especially after a meal that includes cabbage? Or have you noticed more foam in your urine than usual, but told yourself it was just stress or the weather? Because these changes don't cause sharp pain right away, people often ignore them. But in reality, they can be quiet warnings your body is sending. Many middle-aged and older adults in Korea experience these signals without realizing that the cause may be something extremely familiar on the dinner table: cabbage. If you are thinking, it's just aging, you may be underestimating the situation. Once kidney function weakens, the recovery process rarely returns fully to what it used to be. It's like a small stream whose upper flow has been blocked. Water silently pushes backward. The ground dries out, and by the time you notice, the first chance to control the problem has already passed. Many people only discover kidney damage after unexplained swelling or rising blood pressure becomes obvious. And what is most frightening is that sometimes the cause is a habit you believed was healthy. Eating cabbage the wrong way, or combining it with foods your body cannot handle together. But there is good news, too. With just a few small adjustments, you can protect your kidneys, stabilize your blood pressure, and make your body feel noticeably lighter day by day. In today's story, I will explain why a vegetable that Koreans have long believed is good for the stomach can become a burden on the kidneys when it combines with three factors that many adults can experience. If you stay until the end, you will learn how to avoid a common daily mistake without medication. Before we begin, if content like this helps you, please follow, leave a comment, and turn on notifications. That support gives me the strength to continue sharing easy, to understand medical knowledge that middle-aged Koreans truly need. And if you want more age-appropriate nutrition tips, leave the number 1 in the comments. Today, we're going to talk about one very simple topic that has been misunderstood for a long time. Cabbage is only truly beneficial when it is eaten correctly and eaten by the right person. There are three elements that can place a surprisingly heavy burden on the kidneys and blood vessels when cabbage is combined in the wrong way. And especially the second element. Many Koreans don't realize it applies to them at all. A small difference in how you eat can create a huge difference in your health after the age of 50. My name is Yuho Jin. I am a specialist with over 30 years of experience, and I work at a university hospital. Through countless patient consultations, I've learned something very important. Serious health problems do not always come from complex causes. Very often, they begin with foods that are simply too familiar. And cabbage is one of the clearest examples. One of my patients was Ms. Park Seon. He, aged 61, living in Incheon. She believed cabbage soothed the stomach, so she ate it every day. Every morning, she boiled a cup of cabbage juice and drank it hot, believing the hotter it was, the better it worked. But after a few weeks, her abdomen felt increasingly tight, her breathing became shorter, and her feet slowly began to swell. Tests showed her kidney filtration function had clearly declined. She could hardly believe it, because she was convinced she was eating an extremely healthy food. Only after detailed counseling did she understand that cooking at excessively high temperatures destroys the very compounds that make cabbage beneficial. What remains is mostly tough fiber, and that forces the kidneys to work harder. Another case was Mr. Jong-woo Song, age 57. He had been eating large amounts of raw cabbage to lose weight. He had no idea that he already had mild signs of hypothyroidism, something common in Koreans at that age, yet often unnoticed. As he ate large amounts of raw cabbage every day, his metabolism slowed further, fatigue increased, mild swelling appeared, and eventually the burden on his kidneys grew. He assumed his stamina was simply declining with age. He never connected it to cabbage. And the last group I must mention is one many older Koreans don't think about at all, people taking blood thinners such as aspirin or warfarin. They often don't know that cabbage contains a very high amount of vitamin K. If cabbage is eaten in large amounts, the medication's effect can weaken. Small clots can form more easily in the blood, and those tiny clots can travel into the kidneys, microvessels, and quietly block them. These three factors explain why cabbage, although an excellent food, can become harmful when combined incorrectly. Many patients are shocked to realize they were making these mistakes without knowing. Next, I will explain why each situation is risky, and how to make cabbage your friend rather than a burden. But before that, the most important point is this. The problem is not cabbage itself. It begins with eating it in the wrong way. After hearing Ms. Park Sun-hee's story, many people ask me, "It's just boiled cabbage. How can that possibly exhaust the kidneys?" In fact, many Koreans prepare cabbage this way, especially those who believe that drinking hot cabbage juice in the morning soothes the stomach. But cabbage is not a vegetable designed to withstand high heat. Its most valuable nutrients, especially vitamin U polyphenols and stomach-supporting enzymes, begin breaking down rapidly once temperatures rise above 50 degrees C. When those compounds are destroyed, what remains is mostly coarse fiber. For people with weak digestion, it becomes harder to process, and the kidneys must handle more waste than usual. I have reviewed the dietary habits of hundreds of adults in health consultations. One interesting pattern appears again and again. Most people believe the longer something is cooked, the cleaner and healthier it becomes. But with cabbage, that belief is completely wrong. Another patient, Mr. Kim Do-yoon from Busan, boiled cabbage every morning until the water turned a deep yellow. Then he drank it in one go, as if it were a tonic. After continuing this for a month, he found that even one meal made his stomach quickly bloated, and sometimes he had to lie down because of gas. But what concerned him even more was this: by afternoon, his feet would swell slightly, and his slippers felt tighter than usual. When he came to the hospital, his creatinine level had risen noticeably compared to his previous test. When he told me he drank strongly boiled cabbage water every morning, I could almost identify the cause immediately. High heat destroys beneficial compounds and concentrates fiber. That reduces digestive function, and as the amount of undigested material increases, the kidneys take on the extra workload. In your 50s and 60s, digestive enzymes decrease and organ recovery slows, so even small dietary changes can cause kidney values to swing quickly. Many Koreans think, if cabbage is good for the stomach, then a stronger, more concentrated cabbage water will fix the stomach faster. But the body does not work on the rule of the stronger, the better. As we age, the stomach becomes more sensitive. It struggles more with thick, concentrated juice. Digestion slows, and the kidneys end up carrying the leftover burden. It's like pouring wastewater at twice the normal concentration into an old filtration plant that's already been operating for decades. Problems are inevitable. There is another detail many people overlook. They drink extremely hot cabbage water on an empty stomach in the morning. At that time, the stomach has not begun producing enough digestive enzymes, and the intestines are not yet active. So the beneficial compounds are not absorbed well. Instead, the body receives mainly difficult to digest fibers. When the intestines can't process things properly, internal toxicity increases, and the kidneys must work harder to filter it out. That is why many people who drink hot cabbage water experience afternoon fatigue, heaviness, bloating, or cloudy urine. I remember Ms. Choi Mi-jong from Anyang, age 59. She had mild stomach pain, and a friend advised her to drink hot cabbage juice every morning. She believed it had to be hot to soak into the stomach and work. After 1 week, then 2, her stomach didn't improve much. But her face began to look slightly swollen in the mornings, and her hands started to feel stiff. Tests showed her glomerular filtration rate had dropped noticeably. Her daughter was shocked to learn that what her mother started for health was actually weakening her faster. When I explained that cabbage should be cooked lightly and should not be over-softened or consumed too hot, both mother and daughter were stunned. They believed it was common sense that vegetables are healthier the longer you cook them. But cabbage is an exception. Even a few minutes of gentle steaming can preserve its benefits. A few more minutes beyond that, and the best parts are largely gone. Even when people don't cook cabbage, they often make mistakes with store-bought cabbage juices. Many products include sugar, preservatives, or flavorings to improve taste. But those additives increase the burden on the liver and kidneys. Some older patients under my care even saw their blood sugar rise after drinking cabbage juice they believed was healthy vegetable drink. Through these cases, I realized something clearly. Knowing how to cook properly can be as important as choosing the right food. Cabbage is a wonderful gift from nature, but only when handled correctly. If not, it can become a quiet burden on the digestive system and the kidneys. One key reason this becomes dangerous is that kidney changes usually don't create obvious symptoms. The kidneys don't hurt like the stomach. They don't pound like the heart. They don't swell red like an infection. They simply keep working harder, silently, until they reach a limit. That is why so many people never notice mild kidney decline, and one quiet factor behind it can be incorrect cabbage intake. My goal is not to tell people to stop eating cabbage. My goal is to teach you how to eat it in a way that truly helps you. Even gentle steaming and drinking it warm, not scorching, can create a major difference. Properly prepared cabbage can truly reduce inflammation, soothe the stomach, and support kidney health. After correcting the cabbage preparation methods for Mr. Kim, Do Yoon, and Miss Choi Mi Jong, I believe the issue was clear. But as I met more patients, I discovered something else. There is a group exposed to an even greater risk. Without realizing it, people who have thyroid problems but don't know it. In Korea, mild hypothyroidism is extremely common, especially among women after 50. That is why cabbage, though it appears harmless, can easily become a cause of heaviness, fatigue, and kidney strain. I clearly remember Ms. Jeong Mi Ra from Daegu, age 55. She wasn't overeating overall, but she wanted to lose weight quickly. So she began replacing rice with raw cabbage. At every meal, she filled a large plate with shredded raw cabbage and ate it like a detox diet with a light sauce. She repeated this almost every day for nearly 2 months. When she came in, she complained that her eyes looked puffy in the mornings. Her wrists felt slightly swollen, her body felt heavy, and her hands and feet became cold more easily. Many people assume these are normal signs of middle age. But her tests showed her thyroid-stimulating hormone, TSH, was mildly elevated, indicating declining thyroid function. What shocked her most was that she had no idea she was even at risk. Large amounts of raw cabbage made her condition worse. Raw cabbage contains a natural compound called goitrogen. It can interfere with iodine absorption and further slow thyroid function. When the thyroid slows, the metabolism of the whole body slows, like an engine losing power. With slower metabolism, the kidneys process blood more slowly, more waste accumulates, and symptoms such as swelling, fatigue, dry skin, and shortness of breath can appear. When I explained this, Ms. Jong Mi Ra cried. She realized that what she believed was a healthy habit had actually made her body more exhausted. I told her cabbage was not bad. The issue was the way she had been eating it, which did not match her body. People with thyroid risk should not eat large amounts of raw cabbage, especially not as a main substitute for meals. They should consume small amounts, lightly steamed. One afternoon, I met Mr. Kang Woo, Jin, age 60. He had previously been told he had mild signs of thyroid slowing, but he didn't take it seriously. He believed that as long as healthy, he would be fine. Every evening, he drank a smoothie made with raw cabbage, apple, and ice. Then he began noticing swelling in his hands and feet, and a sharp, tingling pain when standing for long. He assumed it was just being active, or the cold weather. But tests showed his kidney function had declined compared to a year earlier. One key reason was that the daily large intake of raw cabbage had slowed his thyroid further, reducing metabolism and adding extra stress to the kidneys. As these issues became more widely known, I thought people would finally learn to eat cabbage properly. But there was still one group I always emphasized strongly, those taking anticoagulants, especially aspirin or warfarin. One patient I will never forget is Mr. Lee Young-hoon, age 73. He had atrial fibrillation and had been prescribed anticoagulants by cardiology. He loved cabbage, especially lightly pickled cabbage or Korean-style cabbage salad. Even after starting the medication, he kept eating cabbage every day. 1 month later, his INR level, a marker used to assess the medication's effect, dropped significantly. That meant his blood was clotting faster, and the medication was barely working. When I asked about his diet, he said, "Cabbage is vegetables. Vegetables are good for you." What could be the problem? That is a very common belief. But cabbage contains a high amount of vitamin K, which supports the body's natural clotting process. If someone eats a lot of cabbage while taking anticoagulants, the medication can weaken, and the blood can form small clots more easily. Those tiny clots may pass without pain, but if they reach the kidney's microvessels, they can cause silent blockages. If not detected in time, kidney function decline and cardiovascular complications become more likely. Mr. Lee was stunned. He never imagined a familiar vegetable he ate his whole life could affect medication so strongly. After reducing cabbage intake, his INR returned to a normal range within 2 weeks. He still ate cabbage afterward, but kept the amount small and avoided concentrated forms like strong juices. These 3 groups: people consuming cabbage too hot, people with hidden thyroid risk, and people taking anticoagulants, had one thing in common. All of them truly believed they were doing something healthy. But health is not determined simply by eating good foods. Eating in a way that matches your body's condition is far more important. Cabbage is actually one of the best vegetables for the stomach, blood vessels, immunity, and skin. Vitamin U helps protect the stomach lining. Polyphenols reduce systemic inflammation. Dietary fiber supports the intestines. And anthocyanins in purple cabbage help protect blood vessels. If eaten correctly, cabbage can be an excellent companion for anyone after 50. But if eaten incorrectly, it can become a silent burden until the body finally sends clear signals. And when the kidneys or thyroid finally send obvious signals, the problem is often already well advanced. So what I want to emphasize most is not avoid cabbage. It's this: eat cabbage correctly, in a way that fits your body. When consumed properly, cabbage can support digestion, reduce kidney burden, and help your body feel lighter day by day. After explaining why certain groups are more vulnerable, I realized what confuses people most is not whether cabbage is good or bad. It's that they don't know how to eat it, and they don't know how to recognize the signals that it doesn't suit them. Not everyone can eat cabbage in the exact same way. Some people feel lighter with small adjustments. Others experience bloating, fatigue, or sleep disturbance because the timing or condition isn't right. In Gwangju, I met a 67-year-old woman, Ms. Han Young-ja. She said whenever she ate raw cabbage, her stomach inflated with gas and felt uncomfortably full. She assumed it was because she ate too fast or because of stress. But at her age, digestive enzymes are often greatly reduced. Raw cabbage contains many fibers that ferment easily, and in an intestine with lower enzyme activity, gas production increases. I advised her to steam it lightly for under a minute to soften the cell structure and reduce fermentable components. A few days later, she told me her stomach felt unbelievably comfortable, and after meals she no longer needed to unbutton her pants just to breathe. That case shows the body isn't rejecting cabbage. It's that the body can only accept it in a certain form. Another group I warn carefully is people who have had calcium oxalate stones. Cabbage is not a high oxalate vegetable, but sensitive individuals can still feel discomfort even with small amounts. Mr. O.C. Jin, age 58, had kidney stones 3 years earlier. He told me that after eating a lot of boiled cabbage, his left lower back sometimes felt a slight sting. When I asked further, I found he barely drank water after meals. When he added just 1 cup of water whenever he ate cabbage, the discomfort disappeared completely. That showed the issue wasn't cabbage itself, but a missing step needed for his body to process properly. On the other hand, those with acute risks must be even more cautious. A younger patient, Ms. Yu Nai-ren, often had epigastric pain due to gastritis. After hearing cabbage was good for the stomach, she ate it raw every day. but the rough fibers of raw cabbage actually irritated the inflamed area. Once I taught her how to steam cabbage very gently, like applying a warm towel. Her pain dropped noticeably within just 1 week. Cabbage is excellent for protecting the stomach lining, but only if it is in a form the body can accept. Some people struggle simply because of quantity. Mr. Park Yong-cheol, age 62, believed vegetables are better the more you eat, so he ate a large bowl of raw cabbage right before bed. Soon after, he began tossing and turning all night because of bloating. After middle age, intestinal movement slows in the evening. Fiber, heavy cabbage can overstimulate the gut and disturb sleep. He changed his cabbage intake to lunchtime only, and the issue resolved immediately. Storage and preparation also matter. Many people cut half a cabbage and store it in the refrigerator for 3 or 4 days. But cabbage vitamins decrease rapidly once exposed to air. Some people say cabbage does nothing or makes them feel bloated, often because they are eating cabbage whose nutrients have already dropped significantly. Cut only what you will eat, wash and slice right before cooking, and avoid leaving cut cabbage for more than 48 hours. Many older adults enjoy cabbage, white kimchi, or watery kimchi. That can be a good option. But the problem is that many households make it too salty. Salty kimchi places a heavy burden on the kidneys, especially for those with hypertension. I always recommend lightly salting it. That allows gentle fermentation without increasing kidney strain. In fact, simply reducing salt can stabilize blood pressure within 1 month in many cases. To turn cabbage into a true, natural tonic, you don't need anything complicated. You need just 3 principles. First, steam it lightly, under 2 minutes. Second, eat an appropriate amount. Third, eat it at the time your body accepts it best, morning or lunch. If you follow only these 3, the positive signals are clear. Your stomach feels lighter. Breathing becomes deeper. Sleep becomes more comfortable. Morning swelling decreases. But there are warning signs you must not ignore. If you eat cabbage and prolonged bloating continues, nausea appears, hands and feet swell, or unexplained fatigue comes, this is a warning that your intake method or amount does not match your body. Your body always gives hints. We simply fail to listen. Looking back at hundreds of cases I've seen, cabbage has always been a vegetable with 2 sides. Prepared correctly, it supports the kidneys, cleanses the intestines, lowers inflammation, and protects blood vessels. Handled incorrectly, when someone with hypothyroidism risk eats large amounts raw, when someone on anticoagulants overeats it, or when someone drinks overly hot cabbage juice, then the body quietly weakens. And by the time people notice, the problem is often already far along. What I hope most is that after hearing this, each person finds one method that fits them. You do not need to give up cabbage. You only need to handle it correctly. If you do, your body will repay you with lighter, calmer health, little by little, every day. Thank you for listening to my story until the end. If this helped you, even a short comment or a single line will mean a lot. And as we often say in Korea, health is protected only when we take care of it ourselves. I hope your days are peaceful, your meals are enjoyable, your sleep is deep, and your body stays well. I'm Dr. Ella Harrison,